We're going to discuss the introduction for the skeletal system. This is going over content that's in exercise 8. The first thing I want to talk about is the divisions of the skeletal system. So the skeletal system is divided into two main parts. So you have the axial and you have the appendicular. So the axial includes the skull, it includes the vertebral column, and it also includes the sacrum as well as the rib cage. Everything else, that's what is included in the appendicular skeleton. And so that includes the upper limb as well as the lower limb. We're going to go over all the different bones here for the skeleton. We have the skull. Within the skull you have the cranium. So the cranium is the part that's where the brain is. And then you also have the facial bones, which are here. And then this structure that's what's known as the mandible. The difference between vertebra versus vertebrae. So when we say vertebra, what we're just referring to is like each individual one. But when we say vertebrae, we're talking about the specific segments. Cervical, it's thoracic, and then it's the lumbar vertebrae. Here, these are what's known as the costal cartilage of the ribs. So you have the costal cartilages, which attaches to the sternum. So this is the sternum, this is the clavicle, and then this is the scapula. So the scapula is here on the back side. So this is the sacrum, and this is the what's known as the pelvis. The pelvis has three regions. So you have the ilium, which is here. You have the ischium, which is here on the back, and then you have the pubic region, or the pubis of the pelvis. Yeah. So what bone is this one here? Humerus. Yeah, this is the humerus. And then the bone that directly articulates with the humerus, this is what's known as the ulna. So you have the ulna, and then you have the radius. Here in the hand, so if you can even put your hand around your wrist. So what you're grabbing right there, that's where your carpal bones are found. So it's a little bit lower here. So you have your carpal bones, and then you have your metacarpals, which are here, and then you have the phalanges. So whenever I'm standing in the anatomical position, so palms out in this way, the ulna is what is medial. So the ulna is here, and then the radius is what's lateral. But then when I turn it over like that, the radius is coming over the ulna. And so you can even look at, y'all see that the x-ray there of the skeleton. So see how it's what's called pronation when you pronate. So that's the orientation. That's why it looks different compared to if he was just standing like this in an anatomical position. So this is what's known as the femur. This is the patella. And what is this bone that's directly articulating with the femur? The tibia. And then we have this here, which is lateral. This is the fibula. So you have the fibula. And then you have, so this is the calcaneus, the bottom part of the foot. And then you have the tarsals, the metatarsals, and then the phalanges. So make sure that you keep the tarsals and the carpals, keep them straight. I've had a student, she told me that the way she remembers them is like tarsals is near the toes. So real simple, and just to remember them, keep them straight. So you have three types of cartilages. We have elastic, we have hyaline, and we also have fibrocartilage. These cartilages are found in different regions. And so what's in between the vertebrae, or the vertebra, this is what's known as the intervertebral disc. So the intervertebral disc, they're composed of fibrocartilage. And fibrocartilage is also found here with where the pubic symphysis is. And can y'all tell me the function for fibrocartilage? Exactly. It's for shock absorption, because think about it, that's why they're in between each of these vertebrae. So you just think about like the force of gravity, is that as we get older, we start to shrink. And so the reason that we start to shrink is because the intervertebral disc, they'll start to degenerate. And so they'll get more thin. And so as a result, right, we shrink some. We're not as tall as we used to be. We also have what's known as hyaline cartilage. Hyaline cartilage is found here, where the costal cartilage of the ribs are, and that is to resist compressive forces compared to like a shock absorption, which was the fibrocartilage. And then another example right? What type of cartilage is found in the ear? Elastic, yeah. So you have elastic cartilage, which is found within the ear. Is the classification of bones. So we can classify bones into four main categories. So you have long bones, you have short bones, you also have irregular. What bone is this right here? This is the humerus. So what type of bone would this be? Yeah, so this would be a long bone. So this would be a long bone. Both of these are long, this is long. And then some of the short ones. So you have the carpals. So the carpals are short. Also the tarsals are short. And also the patella. So the irregular types, so the vertebrae, those are considered irregular. They also have what's known as flat bones. So flat bones, if you look at so they have the scapula. You also have the ribs, which are flat bones, including the sternum. What type of bone do you think this would be? Or this one? Is it short? Is it long? Is it flat? It's irregular, right? Look at it's a different shape. So we categorize the rest of the ones that aren't the short or long into irregular. The bone markings. Okay, so the significance of bone markings is that once we start getting to muscles, we'll start to learn where these muscles attach to, and we'll also learn where these ligaments attach. For instance, here, this is what's known as the mastoid process. A muscle known as the sternocleidomastoid attaches here. So that's why we're going out of the way to learn all of these different processes. So once we start to get into the cranial nerves, so that's in the nervous system, we'll learn everything that passes through here. We'll learn some of the blood vessels that are passing through here. And so this is why it's very important that we have a good understanding of this as we're moving forward. So the first one we have is what's known as a fissure. So a fissure is a slit-like opening, and you can see the probe is going through the fissure. Mental foramen, both of these are right here. We also have, I already mentioned this one earlier, this is what's known as a process. So this is the mastoid process. This is what's known as the ramus. So this is the mandible, so this is the ramus of the mandible. It's an arm-like structure there. You also have what's known as fossa. So the fossa are right here. This is the occipital fossa because that's the back part of the skull. So these are condyles. Right here they're kind of like flat shaped. It's an articular surface. And then this large hole that's here, this is what's known as the foramen magnum. So magnum is large, so the foramen magnum. So for the femur, what you're looking at, this is an anterior view of the femur. This is a posterior view. So there's only two trochanters that you have. So you have a greater trochanter, which is this one here on top, and then the lesser trochanter is here on the bottom. So you have lines, and then you also have what's known as crest. So they're both kind of similar. They're like narrow ridges of bone. The difference is like how prominent they are. So this is what's known as the intertrochanteric line because it's in between both of the greater and the lesser trochanter. The pelvis, so this is a crest. So this is the iliac crest. They're both narrow ridges of bone. The difference is that one is more prominent than the other. Earlier I showed you on the skull the occipital condyles, remember at the base of the skull? And so both of these are also known as condyles. We can use directional terms like we've learned earlier, right? So medial, I know this is medial because of this is the head of the femur, which directly articulates with the acetabulum of the pelvis. So this is the medial condyle, and then this is the lateral condyle. So something that's above a condyle, we know that as an epicondyle. So that's up here. And we also have what's known as tubercles. So one of the examples which is here. So this is medial, so it's known as the adductor tubercle. One of the muscles, the adductor, that's what attaches there. So this here is one of the hip bones. So this is like the whole entire pelvis structure. So this is just one of them. So this process back here, so this is known as a spine. So this is the ischial spine. And then this part right here, this is what we know as a notch. So this is the sciatic notch. So you can compare the sciatic notch with what's on the head, the mandibular notch. So very similar. We're just naming them based off of the location. Is here on the bottom. So this is ischial tuberosity. This is what I said earlier. This is what you're sitting on.